Today we will talk about schizophrenia. What is schizophrenia? Schizophrenia is a chronic, debilitating disorder that affects the way a person thinks, acts, expresses emotions, sees reality, and interacts with others. Although schizophrenia is not as common as other major mental illnesses, it can be a chronic and extremely debilitating disease. People with schizophrenia often have problems doing well in the community, at work, at school, and in relationships. People with schizophrenia need lifelong treatment. Early treatment can help control symptoms before serious problems arise and can help improve long-term vision. What are the types of schizophrenia? There are different types of schizophrenia. The International Classification of Diseases describes them as below. The first type is paranoid schizophrenia. Here is some information about it. It's the most common form of schizophrenia. It may develop in the past more than other types of schizophrenia. Speech and emotion may not be affected. The second type is Heparinic schizophrenia. Here is its symptoms: informal behavior without purpose, irregular thoughts. Some people may find it difficult to understand. Tricks, giggles, health complaints and weight loss. Long-lasting deception and ideas. They are usually between 15 and 25 years old. The third type is Catasonic schizophrenia. Here is its symptoms. It is higher than other species. Unusual movement, often switching between very active and very quiet. You may not speak at all. Let's talk about symptoms of schizophrenia in teenagers. The symptoms of schizophrenia in adolescence are similar to those of adults, but the condition can be difficult to detect. This may be in part because some of the early symptoms of schizophrenia in adolescence tend to develop normally during adolescence, such as withdrawal from friends and family, decreased school performance, sleep problems, anger or depressed feelings, lack of motivation. When to see doctor? People with schizophrenia are often unaware that their difficulty stems from a mental disorder that needs treatment, so it often falls on family or friends to get help. Suicidal thoughts and behavior are common in people with schizophrenia. If you have a loved one who is in danger of attempting suicide or has attempted suicide, make sure someone stays with that person. If you think you can do it safely, take that person to the emergency room of a nearby hospital. What causes schizophrenia? The exact cause of schizophrenia is unknown. But like cancer and diabetes, schizophrenia is a real biological disease. Researchers have identified a number of factors that may contribute to a person's risk of developing schizophrenia, including genetics. Schizophrenia can run in families, which means that it is possible for schizophrenia to be transmitted from parents to their children. Brain chemistry and circuits. People with schizophrenia may not be able to control brain chemicals called neurotransmitters that control certain processes in nerve cells that affect thinking and behavior. Brain abnormalities. Studies have found abnormal brain formation in people with schizophrenia. But this does not apply to all people with schizophrenia. It can affect people who do not have the disease. Environment. Factors such as a viral infection, exposure to toxins such as marijuana, or severe stress conditions can cause schizophrenia in people with genetic predisposition to the disease. Schizophrenia usually occurs when the body undergoes hormonal and physical changes, such as those that occur during adolescence. Who gets schizophrenia? Anyone can get schizophrenia. It affects people all over the world, from all races and cultures. While possible at any time, schizophrenia usually occurs in adolescence or early 20s. The disease affects men and women equally, although symptoms often appear before men. The earlier the symptoms, the worse the illness. Children over 5 years of age can have schizophrenia, but it is less common before adolescence. How is schizophrenia diagnosed? If symptoms of schizophrenia are present, the doctor will make a complete medical history and sometimes a physical examination. While there are no laboratory tests specifically to diagnose schizophrenia, the doctor may use a variety of tests, as well as possible blood tests or brainstorming studies, to rule out other physical illnesses or alcoholism as a cause of symptoms. If the doctor does not find another physical cause of the symptoms of schizophrenia, they can refer the person to a psychiatrist or psychologist, a mental health professional who is trained to diagnose and treat mental illness. Psychiatrists and psychologists use specially designed interviews and diagnostic tools to diagnose a person's mental illness. The therapist supports his diagnosis in the individual and family symptoms and his perception of the person's condition and behavior. What is the treatment of schizophrenia? Schizophrenia is usually treated with a combination of drugs and individualized therapies. In most cases, this will be antipsychotic medications and behavioral therapy. People with schizophrenia often get help from a community mental health team, which provides daily support and treatment. Most people recover from schizophrenia, although they may have times when the symptoms return. Support and treatment can help reduce the impact it has on everyday life. Now we will talk about how to live with schizophrenia. If schizophrenia is properly treated, it is possible to reduce the chances of severe recurrence. This could include realizing the symptoms of a painful episode, taking the medicine as prescribed, talking to others about the situation. There are many charities and support groups that provide help and advice on living with schizophrenia. Most people find it comforting to talk to others who are in a similar situation.